Hello everyone, welcome to our channel. Today I'm going to talk about a few more bubishi points, and I am going to be doing grading and finishing up the semester. So a lot of I'm probably going to take a couple weeks off to get everything done, and so you may not see me for a while. That's why I decided to make this one a little longer than usual. Now this is number 7 on the bubishi, and I am going to talk about certain things that are actually based on clinical data. One of the things I did notice is some of the points that are mentioned in bubishi really seem to be more of a spots to hit with weapons. What I mean is, for the most part, some of these things, if you hit someone there, it's really not going to do much because of the pretty much either the musculature or the surrounding structures, and you're not going to get into something that's really going to cause something vital. Now, there are some people who argue and will say, well, no, they saw that one master who was able to get all these points to work and people were in excruciating pain. And it might be, but I actually like to deal everything with the data that's available. And now, one of the things that happens with data is you can sometimes see patterns that aren't there. Sometimes you can actually see things for other reasons. For instance, one of the interesting things is a lot of times people will look at human health now, and people will talk about how unhealthy we are because there's more cancer now than there ever were in human history. But then one of the things I tell people is look at what the life expectancy is. For instance, here in the US, life expectancy is somewhere in there. I think they said 80, 81, depending on what studies you use. Now, for most of human history, people didn't reach 30. 30 was actually what the average life expectancy was. Give or take 15 years. If you were to do that, you're talking about you'd have some people 45. If you think about it, someone getting cancer at 45 wouldn't be extremely rare nowadays. If someone got cancer back when life expectancy was 30, it really would say certain things were happening. Now, we do have certain things that people talk about, which are clusters. For instance, if we start getting a bunch of 30-year-olds getting cancer who live in a specific area, we know that there's something specific to that area that is causing cancers. If we're dealing with psychiatric problems, we have to remember that for the most part, psychiatry is a relatively young field. I mean, you're talking about Sigmund Freud being the father of psychoanalysis, and things really starting from there. So we have more psychological problems, not necessarily because there's more people who are crazy now than usual, but rather because we now actually have a diagnosis, and we can end up saying, well, this person has this or this person has that. It's not just a blanket, oh, well, everyone's mentally ill now. No, it's degrees, and we have classifications which can help people, because once you know what someone has, you can see how to treat it. Now, I talked a little bit too much about that, I guess, and I'm going to talk about certain points. Now, one of the points that we actually talk about that you see in most bubishis is right in the area where the rib cage comes together with the sternum. Now, I'm going to use my own book, Human Anatomy, and what you have is you have actually this bone here, and in most people that's cartilage, and cartilage is easier to break. Now, I've actually talked about it in my own book, the breaking points, how a lot of people will use the spear hand straight to that area, and people think, oh, well, you're hitting the solar plexus. What you really probably will be hitting for is the xiphoid process. If you're interested in more information on the xiphoid process, I do have it in the Breaking Points book. It's this one here. And what ends up happening is, if it breaks, it can actually puncture some of the internal organs, causing death, pretty much. It's actually not as hard to hit as most people think. And so that is one of the points that obviously, if you hit something like the liver or the heart, it is going to cause death. It's going to cause massive internal bleeding, and especially in a time when we don't have surgery, it's going to cause relatively quick death. The other thing that we actually see people hitting is just at the area. If you were into the nipple line, you'll find a little, and go down, you'll find an indentation of ribs. Now that area is the area of the 7th and 8th rib, which there is another video which talks about the 7th and 8th rib. And that, if those ribs break, you actually can, which is pretty easy at a certain angle, you can actually cause damage to the internal organs. Now, what's there? Well, on the right side, over here, you'd have part of your liver. You also have your lungs. And if your lung gets hit by a piece of broken bone, it can end up making breathing really difficult. If you know anyone who's broken ribs, some people will tell you that they've been laid. I was doing a seminar a while back, and there was a gentleman from Brazil who told me he had been hit in the ribs, it broke, and he pretty much had no fight left in him after that. And so people who have broken ribs and had to go to hospital for it will tell you that those are places that really do hurt. Now the other two that people actually go to is, you can see it on this here. It's at the lower ends of the rib cage. Now some people will say that that's rib number, and they usually go to the side of the rib here, and some people will say that's the edge of rib 11. It's not rib 11, and anyone who tells you rib 11 is in the anterior portion on the side here has never really looked at a human skeleton. What's there is actually probably rib 10, rib 9, and those can break as well. Now, if you actually do it on one side, on the right side, those broken ribs can end up piercing the liver, which again can really bleed. If it's done on the left side, and it's done more towards the side and back, those broken ribs can end up going into the spleen, which is another soft organ, which will end up causing internal bleeding and pretty much ends things relatively quick. Now, besides that, the other point that I found that a lot of people talk about is 2 inches below the umbilicus. Now, if you do get hit there and you don't know how to take a punch, it may actually get you to collapse. But you have a lot of people who train in taking hits, and that's one of those punches that if someone knows how to take a hit there, you can hit them all day and it's not going to do anything to them. And this is one of those points which, again, I mentioned there are some points which I believe were actually made for weapons. If you do get stabbed there, it actually can be excruciatingly painful, and things will stop. Now, I actually do have I'm going to show that picture again because I like it, and it's in my book. It's called the Wound Man, that you've seen before. And what it is it's just, there's actually a picture I've shown before. I'm having a hard time finding it right now, but it's called the Wound Man, and it's in the book here. You can look it up online too, and it does show you certain areas where doctors in Germany were actually looking in the Middle Ages for places where damage could actually occur. And so those are actually the last of the ones that are found in the trunk in the anterior side, the front. In the back, there are a lot of points that people talk about. Now again, most of the ones in the back I find would be most likely done with a weapon. The exception being the one in the back of the head, which we talked about. The back of the neck, if you actually feel your neck, you'll feel a valley in the middle. That has about a 2-inch, in mine it would be about 2-inch thick, 2-inch long spine. And so most of what's on the neck is muscle. You can hit someone in the neck, and chances are all you're going to do is hit muscle. Maybe you'll end up causing some jiggling of the head, which can end up causing problems there, but the damage to the neck would be minimal in most cases. One of the things to remember is the fractures of the neck really require your entire body going down straight onto your head from a relatively decent height. Pretty much some people say you need about 6-foot fall to really break the neck on a 75-kilogram male. Now, the other ones that they point out is between the shoulder blades. Now, I do remember that there are some people who you press on it and they can feel some nerves there, and you can tense up. But again, there's so many muscles in that area that you're really not going to do anything unless you have some sort of bladed weapon. If you do, between the shoulder blades and you get a cut there, you will cause a paralysis. Pretty much everything underneath it will stop working, but you'll still be alive. The other thing that some of the bubishi points are showing are points pretty much just inferior to the scapula. Now, that is an area that could potentially cause damage with blunt trauma because that's where some of the kidneys are. And if you take a hit there, you can cause some damage to the kidneys, which is a reason why blows to that area are illegal in boxing. Again, are you going to rely on something like that, or are you going to look at something better? Especially if you think about it, if you're getting someone's back, that means they're usually running away from you. The other one that they talk about in the back is actually near the shoulder blades, just lateral to the midline, just to the side. And again, that would be a nice spot if you have a piercing weapon because you'd be able to reach the lungs. But other than that, you're really not going to hit anything With the blunt weapon, it really isn't going to do much except for the typical damage that you would get from getting hit. Why it would be a big, again, I think has to do with the bubishi really being intended for medical personnel looking for wounds that would have problems later. The other one that they have is hitting the coccyx. Now, the coccyx is a small, tiny bone about this big, which when broken is excruciatingly painful. But usually the way people break it is by falling on their backside. Usually ice falls, so it requires a lot of force. But if you're looking at it as a site to look at when people are injured, it is one of the big ones to look at. Now, next, when I get back, I am going to finish up the arms and legs. I'll probably do the arms one leg, the legs the next day. And I hope you've enjoyed this. If you do, please let me know what you think. Let me know if there's anything that you disagree with. If you can tell me why, that'd even be better. And I'll let you go and hope you have a good day. Goodbye.